the topic of this podcast was kind of stimulated by a client, a young female dentist who said, Gary, I'm now starting to think about the trajectory of my career, and I'm really kind of thinking about whether I should be a super GP in my career or maybe stay in my lane. And you're right, Naren, the dentistry comes in a lot of different flavors. And I'll answer that question. As if it was, Gary, what should I do? Super GP or staying in your lane? It depends. Like so many questions, the appropriate answer is it depends. And I think, just like you mentioned, Aaron, the decision should be guided by where is your passion? Where is your passion? Are you the kind of dentist that enjoys the diversity of lots of different services in your practice? You enjoy taking lots of CE from different areas and then coming back and applying it to your practice. That might steer you more towards the super GP format. Another reason that you might steer towards a super GP format may be a much more practical concept, Naren. You may be in a small town or a remote area where you don't have ready access to specialists to refer to. And as a result, you want to serve your community, you want to serve your patients, and you want to serve your community. And it may not be reasonable to send a patient to an orthodontist that, say, is 2.5 or 3 hours away. So maybe you're guided to offer orthodontic services for your patients to better serve your community. Does that make sense, Darren?
Absolutely. Even like competition, like for example, in some areas, people don't refer to other doctors. So in those areas, doctors tend to do everything in one shop. So, I mean, lots of factors, Gary. I totally get it.
Yeah, lots of factors here. There's not one right answer, but I would still use as the primary criterion, I would evaluate what is your temperament? What is your personality? Do you like doing a lot of different things? Does the diversity of seeing a really wide cross-section of patients every day in your practice, does that excite you? Or do you look at it more like it's a distraction, when that happens? But, it's really kind of truly knowing yourself, knowing yourself.
The other dimension I see is also this definition of who you are and how you want to spend your time in dentistry continues to evolve and change. Like even Gary, the clients you have served, like when they were young, they were working, 4 or 5 days and they're gung-ho, and then later on, they want to work less and they want to do certain types of things only, as opposed to, everything they used to do 10 years ago or 20 years ago. So this is not, I don't know, correct me if I'm wrong, like what I do as a dentist, as a practice owner, tends to evolve.
Well, it can absolutely evolve. Let me give a good example. I have a client in my client base whose wife was diagnosed with obstructive sleep apnea. And it was through his wife's diagnosis that caused him to take a journey down diagnosing and treating OSA, obstructive sleep apnea, using appliance therapy because of his own familiar experience with his wife. And that was a very motivating factor, for him. So you're right, this can change over time. I'd also like to introduce another concept here. The idea of being a super GP and staying in your lane is not mutually exclusive. You could actually have both of those.
Great point.
Now, you might be scratching your head right now. Let me explain. You can absolutely be a super GP in your practice and make the decision to stay in your lane. Like for example, I have a client that clearly I would describe as a very strong super GP. He has both a fellowship and a mastership in the AGD. And, just having achieved that mastership in the AGD puts him in a very elite company in terms of his clinical training. He's very, very well trained in a wide cross section of services. However, within those services, he stays in his own lane. For example, he's kind of neutral about endo. Let's take a very specific clinical area. He's neutral about endo. He doesn't love it. He doesn't hate it. What I find with most dentists, they tend to polarize when it comes to endodontic therapy, one way or the other. I'll have dentists that say, I love endo, and I like to do as much as possible. And then other dentists will say, oh my gosh, I'd rather slam my head in the car door than do endo. David Hornbrook, who some of you know through this podcast, we've had him many times as a guest and many times as a guest contributor. David is a general dentist in San Diego that has a cosmetic-oriented practice. He does a heck of a lot of cosmetic dentistry. David is extremely accomplished as a cosmetic dentist. He not only is accredited by the AACD, there's only about 400 dentists in the US that are accredited by the American Academy of Cosmetic Dentistry, but furthermore, he's a fellow of the AACD. I believe there's only about 80 fellows altogether. Very, very elite certification. And I asked David one time, I said, David, do you do any endo in your practice? He said, Gary, let me tell you how I feel about endo. Because I'm an artist. When I do my cosmetic dentistry, I think of what I'm doing as artistic. And here's how I feel like about doing endo. I feel like I am picking locks in the dark. Now, I love that definition. I don't believe that's the correct actual clinical definition of endo, but it does describe it. And it describes someone that's visual and loves to see the result. Do you think he's going to enjoy, cleaning and shaping canals? Probably not. Now, maybe someone would enjoy it because they could look at a 3D image and see the results of their cleaning and shaping, but that isn't really David's thing. But this client of mine is very much a super GP, but he also chooses to stay in his lane. For example, this is also a client who does adult orthodontics in the form of both Invisalign and 6-month smiles, and yet doesn't treat children or teens with traditional brackets and braces. He has a great orthodontic referral source that he can refer to for traditional braces. This is also a doctor that does place and restore implants, but even within placing and restore implants, he absolutely stays in his lane. And I asked him one time, he's a early, late career dentist. Naren, early late sounds like I'm contradicting myself, but he's in his 50s, early 50s. So I think of that as early, late, getting towards late career. And I said, tell me a little bit about, since you place and restore implants, tell me a little bit about your failure rate with implants. And he said, you know what, Gary, the most important criteria for me to use is case selection when I do implants. And I'm very proud to say that we have a very high success rate. And he said, I would love to say that it's due to my clinical skills, but he said, I actually think it's much more due to my case selection. I only pick those cases that I know we're going to be able to treat very, very successfully. And I have a great surgeon that I can refer to on those cases that are more marginal, maybe more compromised, and maybe needs another level of expertise. And he has no problem referring those to a surgeon. So it is not mutually exclusive to be a super GP, but also stay in your own lane. In fact, I think that might be a bit of a recipe for success for anyone.